women. Good morning, everyone. Okay, very nice to be here to give the presentation in Hong Kong. To be honest, I came to Hong Kong many times, but for each time I came here for the tourism. So this is the first time for me to do the scientific communication. So I do hope that this is a new beginning for us and between China National Cancer Center to have the communication and collaboration with Hong Kong Anti-Cancer Society. So again, that thanks a lot for Hong Kong Anti-Cancer Society to invite me to be here. So before the presentation, I would say China is just in the beginning of cancer prevention and control. We did a little, really a little for the cancer prevention and control. But we did have a lot and a big challenge and from the bigger cancer burden in China. So that we really would like to learn a lot of experience that from the developing countries and the developing regions, such as Hong Kong. So that I do hope that we can communicate each other and get the experience from you. So very good opportunity for me to listen to the presentations today and participate and the activities tomorrow for the Cancer Day in Hong Kong. So thanks a lot again for the invitation. So for me today, I just briefly introduce some activities we have done that on cancer prevention and control in China, very briefly. So I'm from Cancer Institute and Hospital of Chinese Academy of Medical Sciences, and which is the biggest comprehensive cancer center in China. So in this center, the word changed. And we have a lot of clinical departments, and also some research departments. And also that we have a lot of national affiliations, such as China Cancer Foundation, National Office for Cancer Prevention and Control, and National Office for Cancer Registration, and also some national journals. So that in China, we are leading a lot of national activities on cancer prevention, control, and even diagnosis and treatment. So the good news that Chinese government is going to establish National Cancer Center based on the structure of CHH camps. And to be honest, this is a long story already. And this National Cancer Center was approved by State Commission Office for Public Sector Reform in 2009. But till now, it hasn't started to work yet because of politics. So in 2011, this National Cancer Center approved by the Ministry of Health again, but still not work yet. But good news is, in last month, and finally the Ministry of Health announced the responsible directors. This is the picture for the government to come to our center to do this announcement. So hopefully we'll start work next year. So I think next year you should see the official website and for the National Cancer Center, and should see the official announcement for the National Cancer Center. And that's very pity that this already take a long time. And I came back to China in 2008 because of the establishment of National Cancer Center, but I have already waited for 5 years. So in this center that we will have the cancer hospital and also have the cancer institute, and additionally we establish a new branch and called cancer prevention. We will include cancer information, cancer prevention, and others. So that till now, and we hope that in this comprehensive center we have more comprehensive strategy to against the cancer. Okay, so for my presentation, I think I will introduce some work on these 4 aspects. And also the same as just Sophie mentioned, in the mainland of China as well, cancer is the leading cause in urban China as well, especially in leading cancer in the last tens of years, and the cancer incidence and mortality increased a lot. And according to the GlobalCan 2008, in China we have nearly 2.8 million cancer new cases, and nearly 1.9 million cancer deaths in the mainland of China. And you will see this some data from National Cancer Registration in the last 10 or 20 years, and both incidence and mortality for male and females increased, especially for male and especially for the incidence. Okay, this is the top cancers in China. You will see that for male, the first one is the lung cancer, and then the following ones are the digestive tract cancers, such as stomach cancer, liver cancer, colorectal cancer, and esophageal cancer, and also the bladder cancer. For female, the first one is breast cancer, and then the lung cancer. The following ones are the digestive tract cancers, such as colorectal cancer, stomach cancer, liver cancer, esophageal cancer. Okay, this is the incidence. And for mortality, for the first one, for both male and female, are lung cancer. We are nearly sure that in the near future, and the lung cancer incidence will increase again because of the mist. And you will see that in the northern China, and already very heavy, but now in the eastern China and in the south of China, and it's getting heavy as well. And for male and for the mortality, following the lung cancer and the other cancers are the liver cancer, and stomach cancer, esophageal cancer, and colorectal cancer. And the pancreatic cancer increased in China as well. And for female, for the mortality, the first one except lung cancer, and the following one will be stomach cancer, liver cancer, colorectal cancer, esophageal cancer. Okay. So you will see I think we should have the similar cancer spectrum, right? Yeah. So China is to an extent for the mainland of China, and is not a developing country anymore. I think it's a mixture of the cancer spectrum, and for the developed countries and the developing countries. So now the government is very nervous of the cancer. We have a lot of meetings each year on the cancer. So that based on the information above, and the government already defined the strategies to respond to this big challenge, and including 6 aspects. The first one is that the government will play the biggest role in cancer prevention and control. And then the second one will be the cancer prevention and control will be under the structure of non-communicable disease prevention and control, and also that define the community-based strategy to do this, and also the target the rural areas and poverty population, and also encourage total society involvement, and also build up individual skills and capability. I think this is very broad ideas, and I think everything can be shared in this outline the government did before. And for this one, and they defined the strategy for the cancer prevention and control, targeting 8 cancers common in China, which occupied more than 80% of the total cancer deaths, which are lung cancer, liver cancer, gastric cancer, esophageal cancer, colorectal cancer, breast cancer, cervical cancer, and nasopharyngeal cancer. So target these 8 cancers, and for the risk factor control and target on the typical control, hepatitis B virus infection, a healthy diet, and occupational health. And the main areas is the high-risk rural areas. This is the plan for the last 10 years. So that based on this strategy, the government already defined a comprehensive strategy and for the different aspects. And in summary, I think for this strategy, I will show you that some progress in five aspects. The first one that we built the cancer prevention and control system. The second one is that we improve the cancer information system. The third one that we developed some cancer knowledge dissemination. The first one is that we control some cancer risk factor. The fifth one that I will show you some activities on cancer early diagnosis and treatment. Okay, for the first one. This is a government plan and now is nearly clear. And for this cancer prevention and control system, National Cancer Center will play a very important role, and with the support from the National Ministry of Health, now we call National Committee of Health and the Family Plan, which just emerged in this March. And so after National Cancer Center establishment will establish the different levels of cancer center, which means provincial cancer center and also the municipal cancer center, maybe include the municipal cancer hospital and the comprehensive hospitals, and also the county levels. And at the same time, National Cancer Center will collaborate with China Center for Disease Prevention and Control, and for the national ones and the provincial ones and municipal ones and also the county ones. Because China CDC developed a lot in the last 10 years, especially after SARS. Yeah, they already established very complete and comprehensive network for the disease prevention and control, so that we have a very close collaboration with them, and also that, and of course, that we will collaborate with the governmental department of health in the provincial and the municipal and the county levels. And in the basis that also that in the last 10 of years, Chinese government established a very good network for the primary health care services we call community health service centers. So now that we have a lot in the cities and even in the counties, I can't remember how many centers we have. We did have a lot of the community health service centers. So now it's already do the very basic healthcare services. So this will be the basis for the prevention and control. So this is the system we planned, and so we will put forward the work. Okay, for improve the cancer information system, I also just talked to William. To be honest, our cancer registration starts very early in the mainland of China, can be studied from the late 50s last century. But very pity that it developed very slowly. So that before 2008, we only have around 40 cancer registries, and so covered a very little population. But since 2008, the Chinese government started to much attention to this and invest a lot of money to that. So till 2010, and we have nearly 200 cancer registries and covered population more than 10% of the whole population. So it can't compare with Hong Kong and also other countries. And also the data quality has some problem as well. And you will see that in the IRC database, I think we only have like 10 cancer registries that involved in that database. So that in this way, we still need a long way to go. But still good news that this program already is supported by the government annually with the central budget. And since 2008, we started to publish the annual report to the government, and so the public can reach them as well. Okay, for the developing of the cancer knowledge dissemination, for each April second week, Saturday is our the week is our National Cancer Prevention and Control Awareness Week. So at this time, and I don't know if the similar as in Hong Kong as well. So it's very happy to see tomorrow. Yeah, some activities maybe I can learn. Bring back to Beijing. And in that week, and in everywhere China, we have a lot of activities and to disseminate cancer knowledge. And for each year, we have one special topic on the prevention and control. In this way, China is very good with the activities. A lot of people are very willing to participate, especially in the big cities like Beijing and Shanghai and even other cities. And also we have some large-scale cancer scientific propaganda activities such as Dialogue with Hope and also the Hand in Hope. And also have the China Health Knowledge Dissemination Incentive Plan. And normally we also that we ask a lot of cancer experts and to do the presentations and even to publish a lot of very popular how to say the articles and to tell the public how to prevent the cancers. Okay, for the risk factor control, and we can't say this is a specific action for the cancer, but we do have the action for the non-communicable disease risk factor control or action, which is famous one is in 2007, Ministry of Health initiated this National Health Lifestyle Action and based on the guideline from WHO. And in this action that the government proposed the population and to balance in eating and movement and controlling the oil and limit the salt and also healthy in body weight. They designed several equipment like the oil pot, salt spoon, waste food, and also the health lane and to let the population. In one meeting, I asked how many people to have this equipment at home, and it seems that have less than half, to be honest. And for the tobacco control, I think that's a very big story. Here I can't speak a lot. But in China, we did a lot, but I know that the Chinese government didn't have a very good reputation for that. But we still know that a lot of cities and send the agreement to be the government, and especially for the second-hand smoking, and did a lot of strategies to control the tobacco. And especially now we propose a lot of like non-smoking hospitals, non-smoking schools, non-smoking restaurants, and also the non-smoking public places. And also very clearly marked, and also a lot of propagandas on TV and also the paper ones. Okay, for the cancer early diagnosis and treatment, this one, to be honest, is a very important one. I realized after I returned to China, which government paid much attention to that. And because it started 10 years ago, and from building the early diagnosis and treatment demonstration basis in the high-risk rural areas. I don't know, this is the history, I think it's very different from Western countries. And because in China, especially after the first desktop survey in China in 1970s, we did find a lot of high-risk areas who has a very high mortality, especially for the single cancer types, and very high cancer mortality. Yeah, several times higher than the average level of the national-wide. So like in Qidong, the liver cancer, in Lin County, the esophageal cancer, and also in the Canton province, the nasopharyngeal cancers. So the government and try their best to do a lot of work and to against this big challenge from these high-risk rural areas. So based on this challenge, the government established this early diagnosis and treatment program. So in 2006, and this program started to be supported by the central budget. And this program and targeted the top cancers in rural areas, and normally just one cancer type in one area. And from the 2006-2011, this program already covered more than 100 countries in China. So this is the distribution of this program, and over China, except Tibet, and since all the provinces were covered by this program, and on the top cancers. So in this program, and the key cancer type is the esophageal cancer, because we did find a lot of high-risk areas for the esophageal cancer, and also include some digestive tract cancers, such as stomach cancer and liver cancer. And for these high-risk areas for the esophageal cancer, and you will see that their incidence and several times higher than the national level and international levels. And from this program, and a lot of medical doctors and also the clinicians and were trained during the program, and they started to pay attention and get the skills and for the cancer early diagnosis and the treatment. So it's a kind of that, and the Chinese people started to have the ideas on the public health responsibility to against the cancer. Okay, also that through this program, especially 10 years efforts, and some technology tends to be mature, and the Ministry of Health published the guideline for the cancer early diagnosis and treatment in 2009, in 2010, and in 2011. Okay, so that's program happening in the high-risk rural areas. Another one, I think maybe some people already know that in China we have a special one for women. We call the 2 cancers screening program for rural Chinese women, and including cervical cancer and breast cancer. This program started in 2009, and the Chinese government invested a lot of money to that. And in the first 3 years until the end of 2011, I think should be right. Yeah, and a lot of more screened for cervical cancer and also for the breast cancer. Now in 2012, and the second round already started, and will cover more population. Okay, so this is the second one. And the third one is a very new one, and is led by our center. And because the previous program and focused on the rural areas, so that, but actually for the moment, the biggest cancer burden is from urban China instead of the rural areas anymore, especially with the mist. So that in last year, Chinese government initially launched another program, and in urban China, we call the cancer screening program. In urban China, we call cancer count program. And this program will include 14 provinces. Now we plan for include the 14 provinces, but now it's possible to extend this range. Maybe we'll cover more provinces and cities in China. So that we just finished the first year work. And this program targeted 5 top cancers in urban China. The first one is lung cancer. The second one is breast cancer, which is the leading one for women, and also the colorectal cancer, and also the upper digestive cancers, include esophageal cancer and the stomach cancer, and also the liver cancer. These 5 cancers and occupied more than 60% of the cancer incidence in urban China. Okay, so this is kind of the workflow for this program. So the population firstly will get the questionnaire interview, then that will be evaluated if they are high risk to the cancers. If high risk to the lung cancer, we'll go to the low-dose CT. And if high risk for breast cancer, we'll go to ultrasound plus mammography. And mammography is only used for the woman aged above 45. If high risk for colorectal cancer, we'll go to colonoscopy plus pathology. And if high risk for upper digestive tract cancers, we'll go to endoscopy plus pathology. But if high risk for the liver cancer, we'll go to AFP plus ultrasound. And also that we define the further diagnosis and treatment stage. And also the good one that in this program, the government asked us to involve the health economic evaluation for all the cancer early diagnosis and treatments, and for their referrals to include cancer early diagnosis and treatment into the governmental or decision and the strategy making. Okay, so these are details I won't share anymore. So for this new program, just finished the first one and the first year work, and now the second year work just started in October this year. Okay, so anyway, especially after 2007, the Chinese government invested more and more money to support the cancer prevention, cancer early diagnosis and treatment. And to be honest, I did see the intention for the Chinese government to input the money, but I think the problem is that how to effectively to use this money and to against the cancer, and especially with so big population and the imbalance in between the urban and the rural Chinas, and also the imbalance in different areas such as northern China, southern China, western China, and eastern China. So I think if you work in mainland of China as a cancer prevention scientist, I think you will see the very big challenge for you. Because I worked in the WHO International Agency for Research on Cancer, I always think the imbalance in the world, for the different strategies to against the cancer. But when I return to China, I really see the practical questions, challenges, and in China. I think if I work in China if I can work in China well, I should have a lot of experience for the world. Okay, so for the next steps, very hard to say, but I see the government already initiated the cancer prevention and control into our 5-year plan. You know, in China we have a political 5-year plan for a lot of things, and also that we have the 5-year plan for the chronic disease prevention and control, which we will cover cancer prevention and control as well. And also we will carry out some special actions for cancer prevention and control, and prevention control, especially targeting some special risk factors and also the early diagnosis and treatment for the cancers. And also that the government would like, of course, the government will play the most important role for the cancer prevention and control, but the government also would like to introduce some relevant policies to promote the secondary corporations in cancer prevention and control, and also like the foundations and the NGOs. But in this way, I think in the mainland of China still be less. Of course, finally, that I think government gave the big expectation on the National Cancer Center. Hopefully, if next year and we'll meet, I hope I can tell you more things about the National Cancer Center. So anyway, very good opportunity for me and to introduce some work on the mainland of China. Also, would like to learn some experience from you. Thank you very much.